Thank you for tuning into the Optimal Health program today. Hope you're all doing very well. I know I and my friends and super producer Frankie are doing really well. One of us much better than the other because last night he was able to get to the Yankee game.
Oh,
And apropos to a spectacular win, I'm wearing my Yankee shirt today to support my favorite team. Frankie, can you give us a little idea as to the extent of the electricity in the stadium last night?
well, I'll just say this first of all. I've almost felt like there was a dark cloud over me because I don't go to Yankee games as often as I'd like to, but when I do, it's usually not a great night. So I walk in and I'm like, and I feel some guilt. I said, maybe I should be bringing myself into the stadium because I'm going to blame myself and this horrible shadow that's been following over me. And I'll tell you, shadow has been lifted.
There you go.
Wow. I mean, you haven't had something like that since
Really
for me,
big excitement, you know? And to watch two rookie pitchers battle it out. And of course, thankfully, Cam Schlittler just destroyed a terrific team. You know, Boston's a great team, but this kid was throwing 100-mile-an-hour pitches and a little bit above that and was placing them wherever he wanted to and just completely dismantled their ability. And 12 strikeouts in postseason. That's never been done before. So I think that's the highest number of strikeouts postseason ever. So, of course, all the Yankee fans are excited. If we had any Yankee fans out there, we'd love to hear from you.
Oh, yeah.
Of course, we love our LFA and Rumble group. We love our YouTube and Instagram, Amazon, Spotify, and everywhere else we are pumping out this program. So we always love to hear from you to talk about any topics.
And listen, I'm sure we have some viewers from Boston, so I apologize. Listen, hey.
True. Look,
At least you're not the
Boston's
Mets.
a great team.
Yeah.
And Boston, had a great season, and they've always been a great team. So you can't take anything away from any of the teams that are in the wild card playoffs and get to the World Series. But that's the excitement. There's camaraderie and there's a little bit of competition. And of course, Boston's still unhappy that they sold Babe Ruth to us back, I don't know, 100 years ago, or
They got us back in 2004.
whatever it was. But, it's just nice to see great baseball being played. And whether I watch baseball or football or whatever I'm watching, I want to see a close match, a close game, golf, whatever. I want to see where you don't know who's going to win until the prevailing team takes over and does what it's supposed to do. So,
Yeah, people
sometimes you win, sometimes you lose. Hopefully this year we'll win.
Yeah, someone's talking about Connolly. I'll say it honestly. The Boston pitcher, it's one thing to be, what was it, 24 and 23? Those two pitchers.
Yeah.
It's one thing to be 23, but that pitcher on Boston, he looks 18.
He looks like he's 12 years old.
Yes, it's crazy. So good for him.
But some of these guys have so much talent. Years ago, I treated a kid who was 17, and he was a prospect, to be a pro baseball player. And I think he had a little bit of Tommy John, and we injected stem into his elbow, and he did really well. He got signed by the Phillies, and this is probably 10 years ago, 8 years ago.
I might
His
know
signing
him.
bonus was $2 million. It was unbelievable. A relatively local guy. And I don't know what happened to him subsequently, but, the signing bonuses for these kids, and, some of them are just that talented. Look at them. I would never have expected a rookie to pitch a game like that. He's as good as anybody else who's ever pitched. 12 strikeouts, pretty amazing, pretty great. But today we'll talk about a variety of things, and we're going to take your questions on anything, as we always do. We'll talk about fat distribution in the body can correlate with increased cancer risk. We'll talk about rheumatoid arthritis and how 5 years prior to the symptoms starting to occur, we can see abnormalities in our blood tests. So we're going to talk about the blood test today, too, because although companies online are touting 100 components on a blood test, I've done probably for the 37 or so years I've been doing this, a 200-plus component blood test, because we're looking at all the things that traditionally doctors don't do. But 100 is not that much, especially when you need to look at vitamins, minerals, hormones, cardiac risk factors, homocysteine, fibrinogen, C-reactive protein, heavy metals, through blood and urine. So ours is the most comprehensive blood test you could do. We're also working on a lab to look at the numbers showing for the spike protein so we can see those individuals who have higher amounts of that. There's a terrific Dr. McCullough who's been at the forefront of, giving us all the right information, the good information, seeing all of his patients, young and old, that have had clots and myocarditis and such. And he's put together a protocol for inhibiting the inflammatory mechanism and decreasing the clotting effect. And we talk about that. So we're doing that protocol within our vitamin recommendations and our vitamin pack as well. So we'll talk about that. Other things we can chat about: stem cell therapy for Crohn's disease, stem cell therapy for, and they say it's a game changer for liver disease, which, is what we've seen. So we'll talk about that as well. Coffee also could be very protective of the liver and create liver health, and that's something that most people have never even heard or thought about. But these are good things to talk to you about, so you can get a little sampling of what's out there and really good, well-done research and literature. Any other comments?
Yeah, well, we already got some questions about the spike protein. People are obviously talking about the game. We do have some Boston fans in here, but
Look,
honestly,
I've got Boston fans. I've got friends who are Boston fans. I don't talk to them until, a few days later, maybe a week later. I give them a week.
It's a little fresh
to cool off, and then I have to kind of translate what they're saying sometimes because their accent's a little bit, a little strong. But yeah, I like everybody.
Yeah, and honestly, every time we're in a situation where the Yankees put up no numbers and they lose, it's like I just let it. They deserved it.
Yeah, you let it fly.
Exactly. It's a little easier for me to digest, except when the Astros got some signals going in their ears.
Yeah, or wearing devices under their shirts. Let's not forget that.
Yeah.
I don't like that guy.
I'm watching you.
That little guy. I don't like him.
Well, the funniest part for me was what's Bregman, right?
Yeah.
When he would go up to the plate, the boos in the stadium were probably the strongest out of anyone on the team. But Bregman really has not been doing well against the Yankees on Boston. Like he's the least excitable person. Yeah. But the boos, it'll never leave them. And
so
that's good.
The essence of a good team, and I've always said this throughout every sport I think I've ever watched, your team, in order to win, you have to be a team that can rally and get the single or get the little hit or get the walk or play small ball, If you can't get something done when it needs to be done, you're not going to make it all the way. And the teams that have always been able to do that, Yankees, most times, Boston, Houston. I mean, there are teams that just can rally and get it done, and those are the guys who make it all the way through. So you've got to be a clutch team.
And I'll just add, I'll give a plug because we're going to be, we're on LFA, and I'll say LFA is going to have a nice sports program early on Saturday. You're going to have 9 to 11, and then you get us at 2:30. It's going to be one
really
long
excited
stream.
about this.
Yeah.
Some great things happening at LFA Rumble, and from what we hear, Saturdays are going to be a big venue, and we may be able to get really good placement from what we're hearing, so people can go to the website and, hopefully my funny mug might be visible as soon as you hit the website. So we're trying. We're working as hard as we can.
Oh, yeah. And then on to the spike protein. We got a question. What exactly is the spike protein, and why did it get so much attention during COVID?
So a virus is a protein sequence, and that protein sequence can distort how your body responds to it or to other things. We've long known that Epstein-Barr virus, an extremely common virus that everybody's exposed to between kindergarten and college, like 90% of the world, based upon good studies, that virus has a protein called LMP1, which can inhibit your immune response. So that's been around for a long time. Doctors don't know that, patients don't know that, but I have literature that says that, and I give a handout about Epstein-Barr. So there are proteins that viruses have that interfere with the way your body's supposed to respond, ensuring its longevity, ensuring other viruses from, affecting you. Also, if you have multiple proteins or multiple viruses or infections going on, your body has a hard time knocking all of them out, and maybe knock even one or two of them out, because it has to deal with all this. And viral shedding is how these viruses multiply and go from cell to cell. So as this creature has this very strong protein, which has been diagnosed, and labs now are looking at tests specifically for that protein and antibodies to that protein, we may be able to find some people have higher amounts of it than others. And we want to be able to take precautionary steps for those people and all people who have been sick from the virus or have been sick as a secondary effect of an injectable, that we don't want their clotting factors to go sky high and create a clot or to create a myocarditis. So we're looking at all these tests to see where a person might be in that realm of progression of the bug or a reaction to the injectables. We don't want people to have myocarditis. We don't want people to have clots. We don't want to have these autoimmune things occurring. We don't want to have fertility issues, but this is what's happening and what's showing. There was a great video that Senate hearing with Ron Johnson, the white-haired guy from Wisconsin, I've mentioned this before, had all the heads of the armed forces there talking about the dramatic increases of all of these disorders in young, healthy people. And everyone's seen and heard of athletes that are dropping in the field, and these are some of the healthiest people of all. So I think as physicians, all physicians should, most don't, be looking and learning and trying to figure out what to do to protect a person so that they don't end up with a bad outcome. And this is something that I've been working on for a long time, since this happened. And even before this happened, a few years ago, it was looking at Epstein-Barr or cytomegalovirus or other flu-related viruses and all of this stuff. So my idea has always been, let's learn about your body, get your big blood test done once, and then fine-tune your body, eat right, exercise, get your vitamins on board, correct your hormones, do all the things to make your body stronger going forward, then allow your body to get weaker going forward. And the blood test, and it takes a moment to explain to people. I can say what's in the blood test, vitamins, minerals, hormones, all of that, risk factors. But when a lab has a blood test, and let's say you're between 20 and 30, there are certain ranges that you fit into because of that age. As you get older, 30 to 40, 40 to 50, 50 to 60, et cetera, and onward, the range drops down because it expects you to have lower levels of hormones and vitamins. But you really don't want to have low levels of hormones and vitamins as you get older. You'd rather have levels of a younger age person because you can create and gain more function back. So that's one of the things that I take into consideration that doctors never do. I want to have you functioning as a younger age person, 10 or 15 years younger, so that you have all the strength and the exercise you need to do your activity. You have the ability to go and do a walk or a run or ride a bike for an hour, et cetera. So we want you to be stronger going forward and also preventing risk for disease going forward. So that's a very important part of what I talk about.
Someone's asking, when you say comprehensive blood tests, what panels or markers do you always include?
So CBC, which is red blood cell, white blood cell, the differential, the breakdown of your cells, red blood cells, hemoglobin, hematocrit, platelet count, that's all within there. There's probably another dozen things in there. Comprehensive metabolic panel, which looks at liver, kidney function. We also look at cholesterol, triglyceride, HDL, LDL, the ApoA, ApoB, chylomicrons, all of the secondary cardiac markers, because invariably people, when they come in for a consult, are either have a history of high cholesterol or are taking medication for cholesterol, which I'm not a big fan of because those meds, the majority of them, the statins, wipe out CoQ10, which is bad for your heart and your muscles. We'll look at all of that. We'll look at C-reactive protein, which is an inflammatory marker. Homocysteine, if elevated, that can increase your risk for plaque in your blood vessels, and that's correctable by using vitamins to lower the homocysteine. We'll look at the full thyroid panel, which is 12 different parts, T3, T4, TSH, free T3, free T4, T3, T4 uptake, reverse T3, thyroid antibodies, because when people have thyroid issues, if you're just testing T4 and TSH, you'll miss if any of the other issues are there. So clinically, they may be tired and achy and have hair and skin changes and maybe hypothyroid, but if you're looking at T4 and TSH, you won't find any of the other tests. We can look at the autoimmune markers depending upon what a person presents with. Of course, all the vitamins A's, B's, C, D, E, beta-carotene, all of that, red blood cell magnesium, red blood cell potassium, besides serum magnesium, potassium, red blood cell folate. We look to see if people have that methyl gene defect where they can't make an enzyme, methyl tetrahydrofolate reductase, to break down B12 to get it to work inside your cells. B12 normally exists as hydroxycobalamin, cyanocobalamin, and you have to have that gene to have the enzyme to convert it into methyl B12. Without the methyl B12, it's like you don't have a key to get into your house or a key to start your car, etc. So we want to be able to see that that's, done an important part of the picture. We may look at cortisol, DHEA, testosterone, free testosterone, female hormones, estrogen, progesterone, 3 different types of estrogen. So there are a lot of different things that we're looking at. Epstein-Barr, cytomegalovirus, the list goes on. And honestly, even though it's a big test, we always find abnormalities. Some people come in with a vitamin D of 9. It's supposed to be close to 100. Vitamin D is great for immune response, decreases cancer risk based on worldwide literature, great for your bones. So there's a lot to look at. We test to see if you have allergy to foods because a lot of people do have a reaction to a food. It could be the food itself or the chemicals in the food or the GMO nature of the food. And once we start learning about that and we take foods out of the picture and we see that a person says, my bloating's gone, my headaches are gone, I've lost a couple of pounds, my skin's clearing up. These are things that we routinely see. So we're looking at the entire mechanism. We also can do blood work for allergies to environmentals, things that you breathe. A lot of people have either congestion, sinus, or chronic cough from that. That's a great way to look at what your immune system is spending time on. So there's a lot to look at. I'm probably missing a few things.
You answered most questions, but how often should someone repeat your comprehensive blood testing? Annually, semi-annually?
So that's a great question. What we always do is the first test, and then depending upon what's abnormal on that first test, we'll make recommendations for diet, exercise. Typically, it's going to be low carb because most people have high cholesterol, triglycerides, low HDL, high LDL, sometimes high blood sugar. They want to lose weight, etc. So we'll make recommendations for diet, exercise. We'll correct hormones if they're low. We'll correct vitamins if and when they're low, and they typically are. And whatever else we're correcting, within a month, we would recheck the abnormals, not the entire 20-page, or 25-page test, just the things that were abnormal that we worked on to prove that now your D level is close to 100, that your cholesterol has come down from the diet and the exercise, that your thyroid's kicking back up and your T3 is in a great range where it was low before, and you feel that your hair is doing better, and your energy is back. So, we're looking at a big picture and then making recommendation. This is the scientific method. Learn as much as you can, make the recommendation, and then retest the abnormals to prove that your results are there. Some patients will come back in 3 to 4 months after that to recheck those abnormals to make sure they're still doing well, eating the right way, etc., that the cholesterol's down, all of that. The big test probably done twice a year, but it depends. You don't really need to do hormone levels unless there's some major issue with the younger population. But as women and men get older, as their hormone levels keep dropping, and let's say you're low on some of the things and you need to be here, if we give you correction and now you're here, in 3, 4 to 6 months, your own total production is going to keep dropping. That's just aging and loss of cells and loss of hormones. We may have to raise that up a little bit. So there are a lot of different nuances that we use to understand, if we need to adjust. So adjusting and dancing with the new set of scenarios is what we do all the time.
Those questions. Back to the spike protein. Someone wants to know, does the spike protein only come from the virus itself or can...
Well, injectable and virus, so that's 2 ways to track it. I would like, and I know because I looked online the other day about the labs doing the test for it, we want to see a test that looks at a number, not just a yes or no test, because anybody who is exposed to the bug or had an injectable is going to have a positive test looking for that. I'd rather know how high the number is, with Epstein-Barr, for example, but this is an easy comment to make because the worldwide exposure with Epstein-Barr, if you have exposure between kindergarten and college, and you had mono, is what we call it, you'll have 3 to 4 antibodies positive to that bug at that time. When it goes away, or we do something like the vitamin IVs to help to inhibit it, and you're sort of over it, you'll have one antibody that might always stay elevated so your body can recognize it. That's on purpose, so that if the bug comes back, you already recognize it and build up a response to it. But that's true with any bug. You're exposed to something, your body fights it and will kind of remember it because it has the antibody IgG as a long-term antibody to be there to recognize it again. So antibody tests are good to see where you are in the realm of the infection. If you're tired and achy and you only have one antibody band, Epstein-Barr, it's likely not Epstein-Barr. However, if we start to test and we test Epstein-Barr again in a few weeks and a second or third antibody or a fourth antibody pop up, okay, we know that's raging again. Could be a reactivation or just a new exposure. So I like the multiple antibody tests as well as the test looking for the numbers or the replication or how much you see of something and whether the levels are low or really high. So those are the two types of tests that will be important.
People are just asking if the spike protein is what is actually involved with long COVID issues.
Yep.
What's the deal with that is?
So, without flying in the face of everything, your body makes its own messenger RNA, transfer RNA. It has this whole really complicated chemical sequence of things going on in your body, in every cell, all second, every second, forever. When you put in a messenger RNA foreign, from a foreign substance, what does your body do? Your body looks at that foreign thing and says, whoa, it's trying to tell me what to do. And that can distort your immune response. And that could make other bad things happen. I'll just kind of leave it right there. And you could expand upon that.
Beautifully said. Can the body naturally break down and clear the spike protein, or do we need help?
I don't see evidence of that, and some of the literature talks about, even from the CDC, that there may be a 15-year window of expecting bad things, after the organism itself or after the injectable.
15 years?
That's what forward-thinking doctors and even literature has described that. So that's why we want to be really diligent in evaluating and testing and looking at clotting factors, looking at all these things, looking at heart markers. You start to see the clotting factors go a little kooky, or autoimmune markers start popping up, or cardiac markers start popping up, then you have to be alerted. So what's been used, and McCullough's got the idea of using nattokinase, curcumin, quercetin, a variety of different things that have anti-inflammatory and reparative effect. But again, I go way beyond that because we're looking at all your vitamins. You want to have all your vitamins in a wonderful range. That's why we've created the vitamin pack concept. For a while we've been doing this, and it works out really well. It makes it very easy for people. So when I first started practice many years ago, back in the day, people were kind of taking vitamins, maybe a little bit here and there. It really wasn't that everybody was doing it. And I had to explain to people, well, your blood test for your vitamins shows you're low. You want to do this, do that. Most people did it because it made sense to them. But people typically have gone to health food stores here or there or wherever or online in later years buying vitamins. Some people go to discount places to buy vitamins. Some people get discount bulk vitamins online. But the problem with many of these places is that you're either getting a very tiny dose of something and a lot of names, and when you check your blood, you don't see the benefit because you're getting a tiny dose, but you think it's a good vitamin because it's got a long list of things on the label. But unless your blood levels show your levels are awesome, you're not getting what you really want. So in a perfect world, as I say, the perfect way to take vitamins is to get your vitamin blood test done, understand what you're deficient in, make recommendations with good foods, good vitamins, retest to prove that you're in the perfect range. That's the only way to do it. So for the people that I still see out there that are buying stuff and lots of bottles of all these different things, they're buying too many different things and using things individually as opposed to getting a great multi and adding a few things around that. So with the vitamin pack, that's what we're doing. I'm personally taking that person's blood work, reviewing it with them, and checking off what I would recommend for their morning vitamin pack and their evening pack. So you're getting nutrients in a clear pack. Open that up, take it with breakfast, you're good. And then you take another pack at dinner time. And we could put anything in there. I mean, the manufacturer makes 100 different things, but we put that together based upon your history, your medical concerns, your blood tests. So you couldn't get a better recommendation than that. And then we prove that that recommendation is perfect for you. Granted, the majority of patients I see come into the office for the consult. I examine them, do the blood work. They come back in, we review it. But a lot of people now are doing it online. And we have people coming from or calling from out of state, doing it online, where we do a telehealth visit. We send a prescription for a person to get their blood work done because they don't live anywhere near us. And then we review that over the phone, and then we put together the vitamin pack. So it's going to be done for anybody and everybody. So, and we've hired staff to be able to accommodate this too. So, it's critically important.
Someone wants to know if you do genetic testing as well.
Genetic testing we don't do in the office. We can refer you out for that. So years ago, 2016, 17, and 18, labs were doing genetic testing. And there are two different types. One, there was a cancer test with a swab to see if you had a relative that had cancer, if there was a genetic likelihood that you might get that cancer, and to tell you. So great idea, great test. Every doctor loved it. The labs were charging too much money, like $7,000. And the insurance companies decided, I'm not going to pay for that anymore. So they stopped. And we did it on tons of patients because it's a genius idea, as many other doctors did. There was a second test, I think it was called a PGX, where it would test to see what medications you should never take because they were harmful for the way your body breaks them down. The cytochrome P450 system is one of the mechanisms of breaking down meds into their active metabolites. Medication you should never use because it wouldn't work for you. Medications you can't use together because they would be a problem because they'd interact, or medications that you could use. Another genius idea. What doctor wouldn't want that information? Same thing. Insurance companies stop paying for it. So there are different companies that you could go to get the genetic testing, not just for methylation. Methylation is easy. We do that in our big blood test. But you can get this other genetic information. Some people go to 23andMe. Some people go to Ancestry. There are dozens of companies out there that are now doing the genetic tests. I would tell people don't spend a crazy amount of money on them because most of them should be within the range of $100 to $200, $300. Don't spend $1,500 to $3,000 on something because they say, they're better. But then again, by doing the genetic testing is going to change your world? Probably not.
And
so
I believe we learned on a previous show, one of our viewers let us know that if you plan on doing any crimes, don't use 21 and
23andMe.
23andMe. They'll use your DNA.
Yeah, I mean, whoever it is out there who wants whatever they want can get whatever they want.
That's for sure.
We've seen that over and over again. People say, no, I don't want my information to be out there. I'm like, are you serious? Your information's been out there the moment you were born, got a credit card, started going online to order things. I mean, they have everything they want.
Yeah.
If they want to sneak into your house when you're at work and steal hair from your brush, they could do that. So I wouldn't put it past some of these companies.
Yeah.
People. Bad guys.
Someone wants to know, can taking too many vitamins, even in a custom pack, ever be dangerous? I always get concerned with my multivitamin.
So never in a million years could that happen with what we do because we're retesting you. And we put together recommendations. We retest to prove that your levels are great. So it'll never happen where you're taking too much. Granted, if you decide, well, I like taking this and let me take 10 of them a day, I mean, that wouldn't be prudent, but we would never let you fall into that range. So we know exactly where, because I've done this on patients for 39 years now. So I know what range that we can use. I know where we can add a little bit or subtract a little bit, but that's what the repeat blood test shows. It's very difficult to take too much when you're supervised, but if you're doing it on your own, you might. You could. We don't see it that much, but I had a lovely lady patient who used to get her vitamins and herbs and things in the city, in Chinatown. And she went to a traditional Chinese medicine practitioner, was doing look at the iris, iridology, tongue, etc. And no negative comment there, but they gave her leaves loose in a bag and told her to steep these leaves and do this a couple times a day. She felt so sick one day she came in. She'd doing it for a few days. And I said, well, I mean, it could be viral, it could be anything. And, if you have completely loose, unevaluated, unscrutinized tea leaves, who knows what you're getting. And when we got her blood and urine back, she had huge amounts of arsenic. So she had arsenic poisoning. So obviously we told her to stop everything that she was doing. We had her come in to chelate. We got a lot of the metals that she had on board out of the system, and she, turned out great. But you don't know what you're getting, especially when you get something that just exists in some store with, just loose tea bags.
So
leaves.
the arsenic came from the tea?
Yep.
Come on.
Needless to say, she was furious, and she had called the Department of Health, and that place, I think, was put out of business. But yeah, it's a big health risk. That much arsenic was crazy.
Yeah. Someone wants to know, are there certain groups athletes, older, who benefit the most from these? Oh, is this has this come from an athlete? Is this something that was originally for top tier athletes?
Which, the vitamin packs?
That are coming to.
So, excuse me. I created this years ago just as well because we were using vitamins for patients, many of them athletes. I've had pro bodybuilders, a former pitcher from the Yankees I still see and talk to. He was in the office a few weeks ago, one of my great buddies. Football players to play for the Giants and the Bears, another great friend of mine. So I've seen people that are athletes. I've seen of every sport, patients of all walks of life, young and old, and I've created these as a result of seeing what works the best with these individuals. And in the past, it was okay, here's a multivitamin bottle, here's a vitamin C bottle, and it was monthly amounts of each thing. But now it's just so much easier to take the pack. You get a box with the packs in it, and it's just simple and done. You don't have to go out and buy all sorts of different things. And remember, when people do it on their own, that's also a drawback because you're taking things you may not need, or you may be taking too much, or if you're taking a lot of things individually because someone says, take separate E and separate this, separate that. No, you don't need to do that. You get that in the multi, you're saving yourself money.
With AI and telehealth growing, do you think custom packs will eventually be adjusted in real time, almost like a nutritionist on call?
That's a good question. I don't think AI is going to change that much because you still need a blood test to see what your vitamin levels are, to see what's in your blood and in your cells. So it's not as though you need to have AI look at your blood test and have AI make a recommendation, because obviously that's best done with a doctor. Would it make it faster? Would it make it any different? I don't think so. So it's an evaluation. It's a blood test. Separate day, a week later, a review, and then recommendations. So it's pretty straightforward and easy and thorough as it is now. AI is good for different things, and I'll explain to you how I use it. So my electronic medical record system, Patient Now, is a company, and they've got a wonderful computerized iPad Pro connection cloud system. And I fine-tuned that to have templates for each visit, so I could look at a template and it has all the different things I want to talk about. And when I use Freed AI, I talk with the patient either in the office or on the phone, and it creates a perfect medical note, subjective, objective, assessment plan. Everything we talk about, it puts into a nice little medical note because it's a medical dictation quality mechanism, and I copy and paste. I look at it, everything comes out perfect, I copy and paste. The other area AI is working beautifully with is the RPM that we do, remote patient monitoring. which is becoming a very big component, and rightfully so. So for those who don't know, remote patient monitoring is where we can take an individual who's got high blood pressure, arrhythmia, lung issues, poor oxygenation, diabetes, and Medicare has been sort of spearheading this whole idea because they cover different components of this. So if I see a patient in the office or I do a telehealth visit, we go over their blood work. If they're hypertensive, I can get them a blood pressure cuff at home where they put the cuff on, press a button, it reads their pressure, another button sends it to our computer through data collection. So then it can look at the AI comparison of other blood pressure readings and look at a month of your blood pressure and kind of see where you are compared to other people. Not that that's an ultimate goal, but the goal is I could look at your blood pressure every day and make sure you're doing great. If you lose weight with the diet that we recommend or you're taking nutrients and your blood pressure goes down by 10 points, top and bottom number, I can have a conference call and say, hey, you're doing great. Do exactly what you're doing. Your blood pressure's better by 10 millimeters of mercury, systolic and diastolic. If we also use that for diabetics and they check their blood sugar, whether their finger stick or the device on the arm, the monitor, the 2-week monitor, and we are tracking them because we have them on a low-carb diet, the exercise, hormones, vitamins, and their sugar's coming down, or we do stem cell and the sugar's coming down, we can prove that what we're doing is working, and I can track everyday blood sugars. Doctors never get everyday blood sugars. They never get everyday blood pressure readings. They never get oxygen every day. So if we send them home a little smartwatch, what looks at your heart rhythm, some of them can do EKGs, some of them will do all of them will do the oxygen, percentage, and look at pulse. We have that information gathered. So it's like a doctor's dream for those patients who are a little bit fragile and who might end up with, an unwanted ER visit because things are going bad for a few days to a week. The doctor doesn't know anything about it. And the person goes to the ER and spends a ton of money that Medicare doesn't want them to spend. It could be a $80,000, $100,000 ER visit. So the beauty is if we can track people who are a little bit fragile and make sure we can keep them in a nice tight range for their sugars, their blood pressure, we can see their rhythm, their oxygenation. Great, it's genius. And of course, I think Medicare is happy that they don't have to spend the big bucks on the big, ER visit. So these devices give us the information. Of course, we automatically have it go to their cardiologist or their other doctors too, so that everybody gets all the information. It's just super smart. The other AI mechanism is a company in Switzerland has made glasses where the sidebar of the glasses can read your brain speed. And once it reads that and goes into the computer and to us, they can look at other people of the same age range and compare your brain speed to other people that have progressed to Alzheimer's or who have full-blown or who are slowly progressing. So it gives us a guideline as to whether or not this might happen for you. Then we can intervene and try to improve the condition. In my world, I don't really use the meds that they've used for dementia and Alzheimer's because I don't think they work. And every family member can say, person's been on it for a couple of years. We don't know if it's helping. But if we fine-tune their diet, correct their vitamins, if we look at heavy metal levels and we get heavy metals out of the picture, that can make a big difference in your brain function. So the AI component can be used really, really well within this mechanism. I think they're also putting together devices where you can put a pad on your chest to do an EKG, and you can have a little room in your house. Like people have a room for this, a room for that. Get a little exercise bike and get a cool little couch or a chair there. There are new technologies where you can sit in the chair. It does all these readings of you, and you wear the glasses. All this information goes to the doctor's office. If you sit on an exercise bike with a pad on and you're pedaling the bike, it's like a little stress test. So we can see if your body starts to have some changes in your cardiac electrical potential, from doing that at home. We're not going to make you ride a marathon, but get on the bike and pedal a little bit and we can see the tracing. It's genius. It just gives us so much more information to be able to prevent problems, as opposed to waiting until the big problem happens and then you're kind of stuck with a difficult outcome.
Someone said, "Be honest with me, Doc. You're going to be able to read my mind with those glasses."
I'm reading your mind now. Yeah, so we have another cool thing that we do. It's a unique device. It's a funny stretchy cap you wear on your head, and it does an EEG, electroencephalogram, but all of the little connectors on the cap that are touching your scalp through a little bit of gel go into a computer, and it asks you different questions. You have to click on a button when it prompts you to do that to see how fast you can click and how fast you can answer questions, and it looks at a whole bunch of, it's like a 15-page report. A P300 test, which is brain speed. It looks at different parts of your brain. Is this part slowing down? Is this part affected? So that's a pretty cool test called the brain scan. So that we already do in the office. But, it's a great way to just see what your body's going to do going forward.
And I think this comment was talking about the RPM. They said this is huge for diabetics.
Yeah, it's one of those things that if a doctor knew that it was available and the science was there, they'd be begging for it, asking for it for years. But we didn't know anything about it until it started popping up. And these companies, now there are a lot of companies making these devices. And the smartwatch, you can get them for nothing nowadays. I think some of them cost between $50 to $100. The better ones are about $100. But the beauty of these things is they're all connected and data is gathered and put right into your chart in my computer. So what could be better than that? And we can get an alert. Let's say we want an alert if your blood pressure goes over 180. We get the alert, and your doctor gets the alert, and we can act upon it. There's another one, remote therapeutic monitoring, where you have a pill box, and if you forget to take your pill in the morning because you didn't open that little flap on your morning pill for blood pressure or whatever, we get notified, Mrs. Jones, Mrs. Manicotti, you forgot to take your blood pressure pill. So we could be on top of it. Think of how much this would save in aggravation for patients and save in progression of illness, and even cost. So the ideas are just terrific.
Good on those. Good on questions.
Okay, so fat distribution and cancer risk. This is interesting. Belly fat has the most significant effect on cancer risk, increasing the risk of 3 of the 12 common cancer types: endometrial cancer, esophageal cancer, and liver cancer. So fat and visceral fat increase liver cancer risk. So it may not be totally or perfectly well understood as to why this occurs, but adipose tissue can have increased production of estrogen, which correlate with cancer types. People with obesity often have higher levels of insulin, with this associated with cancers. Chronic inflammation promotes tumor growth. Fat cells produce hormones called adipokines that can stimulate abnormal cell growth. So kind of weird, but interesting. That's why we want to burn down as much of the fat as we can. And in that process of burning down fat, of course, we're burning down cholesterol, triglycerides, sugars, which are damaging for your body. Sugars can cause glycation damage to your cells, your blood vessel wall, cause plaque, neuropathy, many different things. Great study on stem cell therapy for Crohn's disease, and we've treated a lot of Crohn's patients. And this is just a great study. It talks about it shuts down the inflammatory cascade. This was done where they reviewed both animal and human studies and talking about the endoscopic index of severity decreased a great deal with stem. So we use obviously stem for a wide range of different degenerative disorders. Another great comment about stem cell therapy is a game changer for liver disease, because once your liver is damaged or inflamed, there's not much you can do to shut down the inflammation or to repair damage, but stem cells, their entire reason to exist is to repair damage, even from people that have had cirrhosis. And we talk about liver, kidney, and heart failure, so super important. Rheumatoid, I think we have a little video on rheumatoid too. So rheumatoid is a very significant autoimmune inflammatory mechanism and cannot be cured based upon traditional medical approach with meds. And we were saying 3 to 5 years before you see significant blood tests or significant joint changes before the symptoms occur, you can see some of the markers. So in people that have weird complaints, sometimes we'll just pop in the autoimmune markers to see if that could correlate with your body attacking itself. There's autoimmune thyroid, where your body's attacking your thyroid antibodies, your thyroid gland. There's lupus, rheumatoid, Sjogren's, dry eye, dry mouth, scleroderma. So there are many types. But we're seeing more and more of this over the past few years and probably over the past decade. So we have to be cognizant of it, aware of it. Heavy metal exposure, mercury in the teeth and the fillings, it's 50% mercury in the silver fillings. They're inches away from your thyroid. So that we believe, and literature says, that the heavy metal exposure from the mercury can damage your thyroid and cause autoimmune thyroid disease. So we have to kind of look a little bit deeper, be a little bit more accurate in understanding what's going on in your body. And if things start to pop up with blood tests or weird symptoms, you've got to do the second and third test to really see what's going on.
We have that. You want to run that video?
Yeah, let's pop up the video. A lovely lady that had rheumatoid and a variety of issues and conditions and aches and pains. We don't have to run the whole thing. We can just run a segment of it, but
I've been a patient of Dr. Calapai's for several years. After looking at my last blood work, Dr. Calapai said, "We recommend that you're a good candidate to receive the stem cell therapy." I was excited because for years I was looking forward to doing it, know the benefits of it. I've seen it. I've seen other patients, so I knew the outcome would be great. Did the stem cell therapy within about 3 days. I would say I felt great. I could tell you within that 2-week period, I've noticed that my body changed a lot. I am no longer going to bed tired and waking up exhausted. I found that I'm energetic in the morning. The restless leg syndrome that I suffered from for years, I noticed that also went away. My fatigue went away. Started to see a lot of improvements within myself. I suffered from asthma. I could not be around anyone who smokes. After being treated with a stem cell, I realized that the cigarette doesn't bother me anymore, which was great because I always was fearful that I would have an asthma attack, which has happened in the past. I'm grateful for not having any asthma attack after doing the stem cell treatment. Over the years, I've found that Dr. Calapai is very patient, and he explained everything to me, the entire process for the stem cell, the reasons we are doing it based on my blood work. Didn't expect my arthritis pain to go away, and it did. I didn't expect my back pain to go away, and it did. The asthma, I was very leery about, but I'm surprised. I knew it was going to work, so my expectations were high.
that's wonderful. She's a lovely lady. And it's always nice to see when people have a variety of things going on that they don't understand, as we define some of that with the blood work and explain it all. And we put together recommendations to make changes. But what could be more natural than using your own cells to help to shut down inflammation and repairing different organ systems, repairing your lungs, repairing the joint issues, and it's terrific.
We got someone on the chat said, amazing. She went from going in for one thing to 3 things being solved.
Yeah, so there's a lot to be said for the blood test. I mean, of course, when I question patients, I ask them, questions in a million different ways, so I can get a real, clear picture of what's happening. But the big blood test allows us to see things that doctors would never see or do. So most blood tests are CBC, chemistry, cholesterol. Maybe doctors will do iron. They don't go through the gamut. They never test for heavy metals. They never test for vitamins. And I always hear from patients to say, oh, my doctor's the head of the department at this or that. I'm like, okay, let's see his big blood test. And there's no big blood test. Or, my doctor's the head of this and, my shoulder and my knee. I said, well, show me the MRI. Well, we didn't do an MRI. Well, you can't really tell me what's going on in a joint without looking at an MRI, because the X-ray, everyone's seen what an X-ray looks like. It's just you have the outline of the bones, and anything that's bone is white because it's super hard. Anything that's not bone is black. But you never see ligament, tendon, cartilage, cuff, labrum on X-ray. So that's why the MRI is so important. So it's just a better, more thorough way to look at things with a bigger blood test, and with the idea in mind that, you leave no stone unturned. whether it's the blood test or the MRI, etc. Even allergy testing. For some people that have stomach issues, most people, I ask them if they react to certain foods. Some say yes, some say no, because you don't know if something that you eat today is going to create a problem for you in the next 3 or 4 or 5 or 6 days. Or if you eat it every week, you're going to have more and more symptoms to that. So we do a screening for the allergy in the blood, and probably a little more than half the time we find something. We tell a patient to take that food out, all of a sudden, wow, their symptoms are going away or gone. We always do a secondary test after the blood test, skin test on the arm, because that's the gold standard. Remember, a blood test, when you look at the allergy mechanism, when you're taking blood, it's 3 seconds of blood to fill the needle, into the tube rather, so that 3 seconds of blood going into the tube might not have all the antibodies all over the place rushing to the needle to jump in. So that's a screening mechanism. So if we see some things, then we might also skin test some of the most common foods. And if we find those and take those out, then people have pretty dramatic improvement in many of their symptoms.
Crazy. I think this is regarding the heavy metal exposure you were talking about before, but they said, well, thanks, doc. Now I want to physically remove my filling. Calling my dentist now.
So yeah, there's an important comment about that. So if you have silver fillings in your mouth, you don't want to go and have them all removed at once, because then the amount of mercury vapor that as they're removing them, is kind of liberated, and you can breathe those back in. We've had patients that have done 3 filling removals at once and all of a sudden started having a tremor. And then we tested and found out that their mercury levels were really high through blood and urine. So what we'd rather do is look at the blood test for a screening of the recent metals that have come in. That's all the blood test will show you, because it's free-floating metals. Then do a urine test to look at 21 metals where blood is only 4 or 5. Look at the 21 metals, that's what's typically coming out of your storage into the urine. And then do an IV that'll pull metals out and capture a urine afterwards to really see what you're storing, because now we're pulling them out. We typically would recommend doing some of those IVs first to try to get your levels of any of them down as low as we can, then remove one filling. Then a day later, do the IV again, the calcium EDTA chelation, to grab whatever was liberated, and then wait a few weeks, do another. So it's got to be done over a period of time. That's the safest way to do it.
They're saying, thank God. All right.
Sounds like a process, but it kind of is.
Got me.
No, but yeah, that's the best way to do it. Okay. A lot of good info. The website, drcalapai.com. The office number, 516-794-0404. We'd love for you to give us a call. Lots of emails. Thank you for the emails. We spoke about RPM. We spoke about all our testing. Covered a lot of good information once again. Frankie and I, we talk about everything back and forth. And we still are following, the trail of what's happened, with Charlie and his assassination and Candace Owens. And there's just so much more information coming out from different people who were at that site when he was murdered, brutally murdered. Different videos, different angles, viewpoints. This is not just some crazy lone person like they always try to make you believe with political or religious assassinations. It's just not. And I've spoken with people. I had a conversation today with a gentleman who's a veteran and, who's highly skilled in all means of, guns and weapons and stuff. And we have the same belief that it couldn't have been one and could not have been that 3006. And there were a lot of people in that crowd that were probably part of the process. And you add all these other things up that don't make any sense, and they've completely wiped the crime scene so you can't see. There's a good picture of it. There are multiple, kids that have the same look, all within that same place. And the guy with the sunglasses on in the stairwell was supposed to be the first guy that they thought, was involved. So it's just too many weird things that are happening. And of course, if you don't preserve the scene, the crime scene, you're never going to have any information on what really happened. No autopsy was done. So that stopped the information gathering. Crime scene was contaminated by the people that jumped in, and it looks like on some of the latest videos that someone's handing off something to someone who just walks away. And I think the guy with the sunglasses is suspect because he's clicking the side of his sunglasses to activate a camera. Those are Wayfarer sunglasses. I have sunglasses like that, where you could take pictures. And then as Charlie's on the ground, 2 times you see a guy jump across the table and they're handing something away. Then the person goes to take the camera down from behind where Charlie was, standing on the chair that's part of the crime scene, and taking the camera and the SD card out of the camera, handing that off. What's that all about? How does that happen so quickly? And how do you have law enforcement and all these people there not shutting down the crime scene? And now they've completely eradicated the whole scene. They got rid of all the grass. They poured cement. They completely changed that whole crime scene. So this is a huge amount of cover-up.
It reeks, Doc.
Yeah, and there are even more things that I think that are, part of this. Candace Owens was talking about a woman that was walking with Tyler, and no one's sure who that person is right before all this happened.
Here's one for you. There is one thing about that SD card being pulled out, which is very suspect, but take all that away. Just on the campus, look how many security cameras. And we just got...
Right.
There's one right behind him on the roof. See that bottom left?
Yeah.
It's like...
You have vague pictures of a person laying down. There's no picture of a rifle anywhere.
Yeah.
There's no information from all these other cameras. It just doesn't make any sense.
They're everywhere.
And why would the guy, George Zinn, whatever his name is, be there waving and making a commotion? Why would the other kid that was there jump up in front of the camera and make a commotion? It's all ultimately suspect for cover-up. So the whole lone gunman thing, just like the Oswald thing, that's a joke. People weren't savvy back then in 1963 about weapons and didn't have cameras everywhere and the ballistics and all of that. So it's easier to gloss that over and to make it look like something else. But it's just same thing. Not possible for that have been done to JFK that way. The commission was just made to cover everything up. But
what do you think? There's going to be another commission, like a Warren Commission of this, and it's going to be another one of those?
I mean, I wish they would, but even if they did, it's going to be
exactly the same.
Whitewashed or whatever you want to call it. It's going to be, fake. Because the narrative is fake right now. The narrative is not real. And speaking to a gentleman this morning who is, an ammo and gun expert, there's just no chance that a 200-yard shot with a big round like that, could have done what we saw happen. A large round that can knock down a moose or an elephant would not have just made a little mark and a little, blood loss. It would have been big, and in the back would have been a gigantic. And of course, whatever happened, they completely covered it up. So how can we say there's some non-biased action going on when the entire crime scene was completely obliterated now?
Concreted over.
Yeah. Who gave the orders to do that? Why did the college do that? Why was there no CSI forensic evaluation, no autopsy? Because they're covering something up. I think what may have happened was because people that were there said they looked to the left because that's where the sound came from. It probably came from Charlie's right, hit in the back of the neck. You don't see much. Small round. Would have transected the cord. That's why he went to Connecticut and was pushed this way to his left. And the exit wound is what you saw. The only thing that makes sense. But
hopefully, maybe by next week we'll have some more information. Maybe the FBI will listen to the public where we want answers.
I don't know.
It doesn't look good though.
I don't know, but this was more than just a lone person. It wasn't a lone person. This is a coordinated, military type thing. And from what Candace and other people are saying, they think that it's, foreign, for a specific reason. But, and I tell people if there's only one thing that could come out of that is that the way that he worked with people, the way that he respected people, and was talking to people that have a different point of view, that were, some of them are rabid and crazy, and he held everybody with respect. He didn't let the crowd jeer on other people. He let people talk about their, the differences. Try to talk to people about good family values, getting back to God. I'm not sure there's going to be anybody in history that can generate that much or that many people worldwide back to God, back to church, back to good values. So maybe that's something to take away from it that, is a positive, because you're seeing it more and more. I don't know what the number is now. Maybe you could look it up, Frankie, to see how many people are requesting chapters worldwide for Turning Point. It was 30,000 the first, second day, then 50, then 80, then 100. So last time I looked, it was over 120.
Yeah. So 2 weeks ago, it was 62,000, 120,000. Now we're now at 177,000 inquiries.
177,000 inquiries to have Turning Point chapters in different places all over the world. It's pretty awesome.
Yeah. That's incredible.
Part of you hates to think that, wow, this had to happen for people to sort of, wake up and start to understand what's important. But so much goes on in society where people are just sort of like foggy-brained over things and glossed over, and they'll eat the junk food and they'll just follow a certain way because it's easier. But I think all of that, the brain fog and the brain changes and the laxity of thought, has to do with chemical exposure. We spoke about that a few programs ago, about the plastics and bisphenol A, Nalgene, all these chemicals coming on board and affecting brain function, brain ability, making people more anxious. A lot of this is happening, We used to think, oh, cloud seeding, that's crazy. It can't be. Why would we be doing that? And now, a whole bunch of states in the South have made laws against cloud seeding. And people that used to work in the agencies that are whistleblowers are saying, oh, yeah, they're cloud seeding, and it's aluminum, and it's all this other stuff. Maybe that's one of the reasons why we see levels of aluminum are so high in individuals when they come into the office and we check their blood and their urine. So a lot of bad stuff going on. And I think people are being dumbed down in a variety of ways for some sort of purpose. So I've always maintained, read, learn, gain as much knowledge as you can, understand, look at as many different scenarios as possible. You can look at different sources of information and just try to understand and see what makes sense, and then make your own personal environment as healthy as possible, your home as healthy as possible, and don't fall into that rut, where they're kind of pushing you towards doing that. Get your family to have conversations about all of this, about eating right, about exercising, about great family values, bring that back. Get your community involved. Get involved with your community. Do what you can. I like to think that we can get the values back to where they were years ago. Because when I was younger, there was no problem between anybody. Nobody. I went to public school. We never had problems with anybody. There were no political issues years ago. There were no riots. There was no craziness going on. So we have to be able to get back to, a more intelligent society, a society that is really working together towards the greater benefit for everybody. We've got to create more health, better health. I love what RFK Jr. is doing. This is what's been needed for a very long time. And if this is what it takes to pull all this together, we've got to do it. No reason why kids should suffer, no reason why people should suffer.
Yeah, people have a problem with it. RFK is killing us all, they say.
Yeah, it's just, I don't get what's their endpoint to their thought?
Should be the most unifying thing.
Yeah. What's the endpoint to the thought of some of what's happening? What's your goal? Why? There's just no sense there. And I know that some of the people that are paid agitators, they go and they do it because they're getting paid and they want to be loud and crazy and whatever. Okay, well.
Someone's paying them, Doc.
Yeah, no, they're being paid. Everybody knows that, I think. Look at the child trafficking scenario. There are many, many thousands of kids that have been rescued because of what we found out. And I think part of it is because they captured Ghislaine Maxwell and have had her explain what is going on, and were able to go out and save a lot of kids. That's been going on since she was captured. I know that she was talking to the feds, and they've saved a lot of young kids and a lot of people. It's just insane that stuff is going on now. But at least, we're getting on top of it. And we're saving some of the people. I just feel horrible for the families who've lost kids and for the families whose kids have been killed as a result of some of this. And who knows? And I was reading something yesterday about the number of kids that have come across the border that are gone. Nobody knows where they are. They're sent out to places and there's no accounting for that. That's insane. But maybe that's part of, what was going to happen, and nobody looked at it, nobody watched it, nobody stopped it. And they're finding a lot of these kids now. So God bless the people that are finding and helping and taking care of these kids. It's a crazy world. Do the best to stay healthy and keep yourself and your family healthy.
Amen.
Super important. Thank you so much for listening. Give us a call at the office, 516-794-0404. Learn about the big blood test, learn about RPM, all the good things you're doing, the vitamin packs. Email us through the website, drcalapai.com. And we love your comments, and thank you so much. God bless you all.